Um, so we will start today's lecture. Today we are going to talk about examination of the patient. So, so even though I'm going to be using a word patient everywhere, you whilst um, checking the patient, assessing the patient, you will have to be careful about what terminology you use in Australia based on whatever are the legal aspects of it, because I think there are certain restrictions in terms of what you can call the person coming to you for consultation, etc. So you need to follow that, but I'm still going to call that person patient. Basically, patient means a person who is suffering from a disease or a health problem. So that's the thing. Now, this whole examination of the patient is very important because if we don't have a proper system in place for the examination of the patient, then it is extremely difficult to examine the patient properly and understand the health problems properly. Um, Now that we are at the stage, we are going to start studying the diseases, we are going to start studying the pathology of the diseases, and we're going to start talking about treatment of each disease. First and foremost, before that is going to be how are we going to examine the patient, and that is what we are going to study today, or that is what we're going to talk about today. Now, usually when you studied the diploma in Ayurveda, the level one, you must have done a basic understanding of the person in terms of lifestyle, etc., etc., which was primarily meant for understanding what is the dietary habits, what is the lifestyle, and then accordingly making changes to it so that the person remains healthy, or whatever are minor health issues that the person is facing are corrected. Now here, when we start looking at the person now, we will be diving a little bit deeper into the whole aspect of this person's health. And that is where the understanding of how to do that, what is the order in which it has to be done, becomes very important. I think you do have an important aspect of this whole study is your clinics. There are certain number of hours that of clinics that you need to complete, and for that purpose also, this order in which you examine becomes very very critical, or will be very important. And if you follow this order, then it will be much more easier for you to understand where the health issues are, and so on and so forth. Obviously, the part that you studied in the diploma level, that also will be a part of this examination, because now you are not going to be dealing with two aspects of it, the health aspect and the unhealthy aspect. It is the unhealthy aspect that you're going to study, but for which you will also have to understand what are the health parameters, etc. So when we start examining the patient, um, always remember that questioning the person or asking questions to the person is extremely important. And how do you ask the questions is very critical. But whilst you are asking the questions, your observation has to be to the point. You have to have a very strong observation capacity. You need to be observant of the patient all the time, in terms of what the person is saying, how the person is talking, how the person is walking towards you when the person enters your clinic or your consulting room. Is the person exhibiting any particular traits of pain or any kind of discomfort while he's explaining you particular things? So observation plays a very critical aspect in examination of the patient. And when I say observation is um, not just seeing the person visually, also your sense of smell, whether what are you smelling, is there any different smell to the person that has come for examination. Now you may find it weird that what has that to do, but different smells are exhibited by people body odors. I mean, I'm saying, and I'm not saying of a body odor in terms of a foul smelling or a bad body odor, or just because he has not maintained his or her hygiene standards. I'm not talking from that aspect. Because of certain dosha aggravations, because of certain physiological changes happening in the body, the person will have body odors which are exhibited. And those also need to be observed whilst you are understanding the patient. Obviously, this will come by experience, but it is extremely important that observe the patient whilst you are asking the questions. Do not be only asking the questions, not observing anything. That will certainly not be helpful, I would say. Now, coming back to this, you need to take particulars of the patient which are important from record keeping also, and also from an aspect of understanding certain things that you are going to consider whilst examining the patient. So the first and foremost is name. Obviously, you need name because that's the identity of the person. Now age. Now you will ask the age. So ideally, what we do is we have a basic form that we give to the patient to fill in. Okay, and then the rest of the questions are asked by the consultant, which you can also follow the method. So this basic information, which is something which does not need your asking questions, can be given to the person to fill in, and the rest can be then asked and jotted down. So age. So what is the purpose of asking this question of age when a person comes to you?
The dosha time of the life.
Okay, dosha time of the life. Okay, what else? Yes. Why do you ask this question of age?
Maybe it can give an information on, well, some disease can appear with some age.
Like,
So
you're on the right track, but yes, like,
the lifestyle is different during the age.
okay, lifestyle is different with the age. So, see, when you ask question like age, understand that Francesca said that different doshas will be dominant during the different stages of the life. That is number one. So obviously, if the age is below say 12, 13, then you have to be aware that this is a kapha dominant phase, and there is a likelihood that the person may have more kapha diseases. In the middle age, there will be chances of pitta diseases. In the later part of the life, there will be chances of vata diseases. This is a very basic understanding that you must have studied in the year one. Now, when we look at it here, the question of age is asked for a couple of things. Like, for example, if a person is sitting, first and foremost, if the person tells you a particular age, say a person says, I am, say, 40 years old, or the person writes down is 40 years old. But then if you are seeing that the person is looking older than the age, for example, okay, there are a lot of aging signs in the person. Like, the wrinkling is very too much. The person looks thin and frail, maybe has lost hair. So what is that indicating? That is indicating the dominance of vata in the body. So what is that indicating? Maybe an early aging is happening in that person. A person, say, is a pitta constitution person, or is indicating that at the age of 25 is already balding, for example. What is that indicating? That is indicating early balding, early graying. So what does that indicate? That indicates that, okay, I need to go and check whether there are any positive factors that is causing this. Now please understand that a lot of times patient do not understand what to write in the case paper when you ask them to write down about their health problems. people will only write down what is important for them at that time, what is most problematic for them at that time. Rest of the conditions they will forget. Conditions which have been there throughout their life, have been troubling them for the last 20 years, they will forget to write. Or they will feel, oh, that is not important. Because right now, I am having, severe headache, I will only write headache there. Or I am having a dental pain, I will only write about that. I am having cold right now, I'll only write about that. So a lot of times patients do not understand this, that the way we look at it as a health problem, or an Ayurvedic consultant would look at it, would be a more holistic approach towards health than just looking at what is happening right now, giving medicines and getting rid of. So we are not dealing with the acute conditions. What is an acute condition? An acute condition is a condition which is showing its signs and symptoms at this moment of the time, which is temporary or which has just come up and which is showing dominant signs and symptoms. That is an acute condition. Acute also means severity. If the severity is high, we will say it's an acute condition. But when we deal with the patients, we are also looking at chronic conditions. Chronic meaning what? Which have been there in their body, in their system for a long time, and have been troubling them, have been giving them problems on and off. Say, for example, somebody, has a problem of, constipation. But constipation which is not consistent, a constipation which is only there when the person eats some, bad foods, or travels, or gets stressed, changes homes, etc. So if there are these kind of conditions, the person is most likely to forget those conditions to write. And that is the reason why when we ask questions, you have to dig deeper. You have to keep asking more and more and more questions to understand exactly what all health problems are there. Coming back to the discussion on age will give you an indicator as to whether the dosha dominance or the dosha aggravation is normal, meaning as per the age, or it is beyond that, if it is happening more, etc. In women, age will play a vital role, because age will define certain conditions, whether this is an age of menstruation, this is the age where the woman is fertile, this is the age where the woman is undergoing menopause, this is the age where, the women, the lady has stopped menstruating and stopped for the chances of fertilization also, having babies also. So that is the reason you ask questions. I mean, you cannot, if somebody is sitting there and if you don't ask a question to that person, the lady is 65 years old, and you ask a question, how are your menstrual cycles? That would look stupid on our part as a consultant to ask that question. So basically asking, because a lot of times you may not even understand the age of the person. You go to Japan, everybody looks 30, 40. Nobody even 20. I'm 30, 40 is also old. Even an old lady would look like, 20, 30, or would be dressed like that. So you cannot ask a question based on how the person appears, looks, is presenting themselves. And that is why age becomes a critical aspect in understanding a lot of things in terms of health issues. So let them put down the age. That will give you a lot of indications in terms of health issues, in terms of whether things are progressing normally, whether the person is aging properly or not. Uh, Say, for example, if the person is starting, say, around 40 years of age, or 40, 45 age, okay, and the person is saying, oh, I have some problems with my bones, I have osteoporosis, okay. Now, if the person says, I have osteoporosis, the person is 40, 45, you need to understand what is physiologically happening at the age of 40, 45. Is osteoporosis that serious that the person is complaining of osteoporosis and you need to take care of it in terms of a serious health problem, or make that person understand that your bone density levels are as per the normal standards of a person at that age. So you need not worry about it. Obviously, I will give you something to maintain the bone health, but it is not a matter of concern because physiologically you are going to have a certain bone density according to which your body is showing a bone density. Everybody who is about 30-35, if you do their bone density test, most 95% of the people will show osteopenia, which is the starting point of osteoporosis. So somebody then comes and gets scared, oh, I'm having osteoporosis now, I need to do something about it. You need to be aware what happens at particular age time, and accordingly guide the person that, there is no need to worry. I will handle it, but this is normal as per the physiology. And that is the reason understanding of the age is important. Now, the next thing that you ask is sex, male, female. Today, there is a lot of drama happening on this. So, you just ask them to write whatever they want. You don't ask any further questions beyond this because there's no point getting into these. Whether the person is male or female or, a transgender. And accordingly, you can treat the person without discussing this more. Um, Religion. Now, this is something that is, your discretion whether you want to ask or not. But uh, if you understand the person, I would say religion or ethnicity, what is the origin of the person, where the person is originating, whether the person is of a European origin, whether the person is of a East European origin, whether the person is, Asian, whether the person is African origin. It's is important because it gives us a lot of insights into their dietary habits. What are the staple foods these people eat? What kind of lifestyle they may lead? So for that purpose, this understanding is important. In India, when we consult, we ask religion also because religions also play an important role in what they eat, what they don't eat, etc. So while suggesting diets, while suggesting foods to consume, not to consume, this knowledge would be important. Now, obviously, you won't suggest eating, beef to a Hindu person. You may not suggest eating pork to a Muslim person. So that's a common understanding that you would have, because you don't want to ruffle any feathers there. So obviously you would have that understanding, which will also come from the name, the background, etc., etc. So religion is something that you ask or you understand, you observe. You can always ask for the ethnicity. You can always ask for the background, which will give you a deeper insights into their lifestyles, their food habits, etc. The next question is education. Primarily, this you ask from an understanding in terms of, whether the person, mainly it's for academic interest more than any health related matter. Marital status, single, divorced, married, because that will also give you an idea as to, uh, some health issues if you're going to check with that. Those. Occupation, you will ask the occupation because a lot of diseases would be related to occupations. Like for example, if a person is, we have said about this, if a person is chef, working in kitchens, then you would obviously be uh, aware that the person is constantly working near the fire, near the heat. So that is something which is going to cause disturbances with the Agni, with the Pitta. So knowing that will be important. If the person is, say, a carpenter, if the person is a mason, then the person is going to be working outdoors, or a gardener, the person is going to be working outdoors in the sun. So obviously you will see those impacts of sun, of exposure to sun, of exposure to wind on the skin, on the body, on the physiology, on the diseases also. So that is the reason you ask occupation. A lot of times people who are working in high loud noises, etc., can suffer from conditions like tinnitus, which is ringing in the ears. So you will ask them questions which will give you an idea as to whether the occupation is related to the disease, or is the occupation playing any role in increasing the signs and symptoms of the disease. Now, does that mean that you ask the person to stop working? You cannot. But making them aware or giving them suggestions in terms of what care they should take, in terms of, if occupation is adding to their causative factors. Because what does Ayurveda say? One of the things to do when a person is suffering from any health condition is to avoid the causative factors. When you start treating a person, when you start treating any disease, what Ayurveda says is you also need to simultaneously stop avoiding the causative factors. But if basically the causative factors are coming from unavoidable circumstances like occupation, then you cannot stop the person from getting exposed to causative factors. So then you will have to counter that by certain changes in the lifestyle, by considering that these are not, it's not possible to change that. Accordingly, you need to give suggestions in your entire um, suggestions list, how to counter the adverse effects of the occupation. Say, for example, if a person is works night shifts, if the person works night shifts, then you know that the person is not sleeping in the night. Then the person is going to be sleeping during the day. Now, according to Ayurveda, sleeping during the daytime is a very bad causative factor, or a very adverse causative factors which causes disturbances with the kapha and pitta. Now, if you see that this person who works in the night shift, sleeps during the daytime, is suffering from reflux, is suffering from gastric problems, is suffering from digestive problems, and you are suggesting them treatment, how will you correct this problem of working during the night shifts by suggesting a lifestyle change? What will you do? Yes, anyone? Person is working in the night shift, so obviously the person will come home and then sleep, right? Because that's what all people who work in night shift do. And if this person comes to you and is complaining about gastric problems, is complaining about reflux, is complaining about bad digestion, what would you do? We can't tell them to stop working in the night.
Well, that's to me, it's very hard because as we learn, we know that we need to sleep during the night because of the sun and the moon and regeneration. So to me, it's a hard thing. I will still say to that person that's the issue.
Change your
You
work.
need to change, and I had change. For example, I had change on my own. I had changed a job because I knew it was not good for me, and I believe a job is not everything in life. So if it's make you heal, then you need to change. Then it's
So,
up to people. It's up to people. We can't do that. He's there.
so are you saying that you'll ask that person to change the job?
I will explain them why what's making it wrong in this situation. And
So say let's look at, taking this further. Say for example, this person is working shifts. Okay, I'm not saying it's constantly working in the night shift. Is working shifts, sometimes as a morning shift, sometimes in the afternoon, sometimes in the night.
well, then if you talked about the gastric issues, I will suggest what we say, like avoid spicy food, not drinking too much water, all of these basics that we know, and they take it or leave it.
So see, we don't really live in an ideal world situation. Okay, let's first accept that we don't live in an ideal world situation. Uh, in an ideal world situation, yes, I would have said, oh, you leave the job and get some other job. But people will have issues, people will have challenges, people will have to continue working in the jobs which they are working. A lot of countries are there where having a job itself is a luxury. If the person doesn't have enough education, either enough work experience, then whatever job the person gets, we'll have to live with it and find a solution around that, to that health problem. So as a consultant, when we sit down, though I understand that the most ideal situation would be to leave the job and correct the health problem, because health is everything. But end of the day, that is not how the world you know functions. The person may have the responsibility of the family, may have responsibility of kids, etc., and in that situation would not have an option of leaving the job. Then what happens? End of the day, we have to suggest them what is the best possible solution we can offer, right? That's our job. And obviously making them aware that sleeping during the daytime is a problematic situation. Okay, but if you want to get rid of it, if you want to still feel better, follow this instead of what you're doing right now. So what would you do in that situation? What usually happens with these people who work in the night shifts? What do they do usually?
Well, uh, I will suggest, like, first of all, don't eat and then go to sleep as soon as you arrive home, because that's something that happened. Uh, Try to do at least like a couple of days a week some exercise to like the ama that is in the body. No,
Mm-hmm.
avoid like alcohol, avoid like smoking, like any kind of drugs, and all like pita aggravation things that is more common in people that work at night,
Mm-hmm.
at
Yes,
least.
yes. Okay. So excellent, Pedro, because you are very, very close to what would be suggested to this person, or what lines would you think upon, you know so exactly. So when a person is having a situation like this and you want to suggest, first and foremost, try and get rid of things which can be more problematic apart from the day sleeping, which come in because of the night working, which would be drinking coffee constantly or smoking something, to keep awake, drinking coffee to keep awake. Now, that's something which is, though it is occupation related, it is not really occupation related. So getting rid of that is one thing. Then secondly, what is important is most of these people who work in the night shifts, they will come home, they will have a heavy meal in the morning, or eat a heavy breakfast and go to bed. Now, what is that? That is problematic because one, you have not had a proper night sleep, which is the ideal time for sleep. Then you come home, you eat food, and then you go to bed and you sleep, which is going to disturb the Agni further and cause armor formation in the body, which will then start the vicious cycle of all the gastric problems that the person is exhibiting or showing or telling you as his problem areas. So then what do you do in this case? You need to tell them that when you come home, okay, you don't need to eat a heavy meal. Okay, you can probably have a fruit or something. Okay, take a shower, then sleep, then you wake up, then you eat. So if a person is sleeping empty stomach, if a person is sleeping without the food in the stomach, then the chances of excessive pitta and kapha aggravation which is going to happen in the body are reduced. Like mentioned by Pedro, asking them to do some exercises a couple of times a week is also important, because that exercise will keep them, healthy. What do these people do? These people will come, they will eat a heavy meal, and then they will go to bed. They will go to bed, they will sleep till late afternoon or evening, then wake up, then have shower, again eat, go to work. So their lifestyle is extremely, you know, disturbed, because there is no exercise, there is no movement, there is constantly eating and sleeping kind of a thing, or eating and staying awake whole night as a lifestyle, which both are damaging for the body, which both are damaging for the. So one thing which we cannot avoid is eating and staying awake, which is a part of their, lifestyle. Okay. So that is something which cannot be avoided. So at least this other part, which is eating in the morning and then sleeping, can be avoided. Also, it is said in Ayurveda that if the person has not slept in the night and is sleeping during the daytime, ideally the person should sleep half the number of hours the person sleeps during the night. So if the person is sleeping, say, 8 hours in the night, the person should sleep 4 hours during the day. Is what is the principle given. Now, what is that? We are not going to stick to it like, okay, you sleep 6 hours, so you cannot sleep more than 3 hours in the morning. But an awareness of this, that if the person usually requires, say, 7 hours of sleep, then if the person tends to sleep for more than 5 hours or sleeps for 6 hours during the daytime, that is going to cause aggravation of kapha and pitta in the body. So making this person aware what is the ideal duration of sleep for this person during the daytime is equally important. Now, if you have done this, then at least you have reduced the chances of problems in this person's body to a certain extent. I'm not saying you're going to 100% take care of the problems, because certain things cannot be avoided because of the lifestyle, because of the certain restrictions of lifestyle that you have. But you will certainly control a lot of adverse things happening in this person's body and put him on the track of right health, healthy life, by suggesting him certain things. So occupation, knowledge of these things will play a role in your understanding of pathology, also in understanding of suggestions also to be given, the treatment to be given also. Your occupation knowledge will play an important. The next part is address. So address is primarily, so that you know where the person stays, etc. Has very less bearing on the diseases, except for the understanding if the person is staying um, in a climate which is not supportive of the health issues. Like for example, if the person has recurrent respiratory problems and the person is staying, say for example, you are in Gold Coast, but the person is from Canberra. If the person is from Melbourne, then you will have to understand whether the location where the person is staying is also adding to the health problems or not. That is something that you will understand from the address, permanent address of residence, which also then you will have to consider and suggest things to countering the effects of the environment, the surrounding, the climate, the temperature of that particular area where the person is staying. Okay, so that is the reason you ask address as one of the things. Now, the next thing that you have to ask the person to write down the chief complaints. The chief complaints are basically complaints which are to be given immediate importance, or the reason why the person has come to see you. There will always be a reason why the person has come to see you. The reason might be, my knee is hurting, my back is hurting. Okay, I have skin problem, I have headaches. So whatever are the chief complaints, whatever is the reason why the person has come to see you, has to be written as chief complaints. So you need to explain this to the person, that you write down your chief complaints here. Now the question would be, what is chief complaint? Which means, why have you come to see me? What is the reason? What are the health conditions for which you have come to see me? Those are the chief complaints. So the person will write down that, basically I have, headache, or I have, say, a joint pain, I have knee problem, I have backache. Whatever are the chief complaints, the person will write down. There may be one, there might be two, three, there might be a list of 10, etc. Then the next thing that the person has to write down is associated complaints. Associated complaints are complaints which the person has health problems, but may not be showing the signs and symptoms right now, or may not be important for that person right. So say for example, the person has come to you as a chief complaint of, um, say, a knee pain. The person has knee pain and a person has, um, you know, back problem. So that is the main complaint. Now, associated complaints can be anything like, say, constipation, for example. Associated complaints can be reflux, which is not seen at this moment, which is not the main reason why the person has come to see you, but has these problems. Maybe the person has problems like, sleep issues, cannot sleep properly, has disturbed sleep. So whatever are the associated complaints the person feels written down, need to be written down in associated complaints. Now, when you sit down to take these details, or when you take this sheet and when you are going through these questions or when these details, you need to every time ask the person, if the person has given you the case paper or written down details on the examination sheet, and then you are reading through it, you have read the chief complaints, you should always ask, do you need to add anything in this as health problems for which you need immediate attention or for which you have come to see? A lot of times people forget whilst writing. When they sit in front of you, they'll say, oh yeah, 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 I also forget. I also forgot that, I also have this problem. So always ask, add that up, do not blindly trust that person, because end of the day, the person is having health issues. So health issues can affect a lot of things, including the mind, because mind is going to be playing an important role in the formation of various diseases. So if the mind is not functioning properly, then obviously you cannot trust the person 100% on what the person is writing. You will have to ask questions. You will have to dig in. Same with associated complaints. You will have to ask, are there any other associated complaints you need to write down? You remember, write down. Then the next thing is history of the present illness. So what I do usually is, I don't have these as separate columns, or I don't ask the person to write down history of present illness or history of past illness. I only ask them to write down chief complaints, associated complaints, and family health history. And then when I start asking questions, I will ask them every time. If the person has written that I have a knee joint pain, I will ask since when. So the person will say, oh, maybe, last 3 months I have been having this problem, or last 2 weeks I have been having this problem. Okay. Somebody says, I have back problem. Since when? Okay, I had an injury. I injured my back while doing something 3 weeks ago, and since then that I am having this problem. I am suffering from constipation as an associated complaint. Since when? Oh, as long as I remember. So people will give you these answers, which will give you details in terms of what health issues they are having, what dosha is associated, what is happening in their body, what are the chronic problems which are there in the body. And you will have to mention it right down, right, like this, that since 5 years suffering from constipation, or today the person is 30 years of age and the person says since the time I remember. So you will have to ask, but do you remember when it started? Like, did you have constipation when you were a kid? So the person will say, no, 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 I remember maybe, 15 years, 20 years since I remember, I have always had, on and off constipation. So write down 20 years constipation. This will give you an insight into dosha aggravations. This will give you insights into, what can happen from particular chronic conditions happening in the body. Write down all these details. You have to make note of it, how long they have been. Then also ask for origin. What is origin? How did this disease start? What happened? Why this disease started? How did your back problem start? How did your knee problem start? How did your skin problem start? Ask these questions. The person will explain. Oh, you know what? I had gone for a trek, and I had gone for camping, and after I came back, I had you know a slight fever, and oh no, they will just say, I had fever, and then after that I have been having this joint problem. Somebody will say, I just went for camping, and since 5 years I have been having this joint problem. They may not remember of certain things that happened. So this will give you an idea as to why this problem started, from where the problem started. Was there any causative factor that has led to this? So asking questions in terms of origin will play an important role. Somebody comes and says, oh, I'm having menstrual problems. What menstrual problems are you having? Painful menstruation, irregular menstruation. Okay, since when? Since, 2 years. Oh, okay. How did it start? What happened? Oh, I had a very serious health problem where I was ill. I was sick for 6 months, 8 months, and after that I started having this problem. What insight it gives you? Oh, okay, you had a health problem. Then you ask what kind of health problem you had. Then she would say, I had a severe infection, for example. I had severe infection, I was hospitalized, and so on and so forth. I had food poisoning and I was hospitalized. Okay, did you lose a lot of weight during that time? Yeah, 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 I lost a lot of weight during that time. So what does that indicate? Yeah, okay, you know that, okay, 2 years ago, because of a certain health issue that happened, vata aggravation has happened, because of which this problem has started. So when you sit down and when you start asking questions, you know, it it is it is like a jigsaw puzzle. You are thrown this set of Lego in front of you, and now you have to join it together to make a very clear picture out of it. And for that, you will have to, keep on asking questions, keep on, knowing more about it. Initially, it may sound very intimidating, what I'm talking about. But as you start doing it, and as you start applying all that you have studied, it starts becoming very interesting, because then things start coming back to you. What you studied, you start understanding what you studied how it is presenting in people in front of you. And then it starts becoming very interesting. But asking questions, asking a lot of questions is extremely, extremely important. If you don't ask questions, then you may lose vital information. You may lose vital clues as to why this is happening, how this has started. And you may also lose clues which will give you an idea of what is going to be your line of treatment also. Now, whilst you are doing all this, chief complaints, associated complaints, history of present illness, history of past illness, you're talking to this person. And like I said, you're observing this person whilst you're talking to this person. It is extremely important that, the way the person writes down the complaints will also give you an idea of what is the constitution of the person. The way the case paper is written, how the person has written down information, will also give you an idea as to what is the constitution of the person. A person who is Pitta constitution, I have seen so many times, they bring their notebook with them. In the notebook, they have written down all their health problems in that. Then they come, they will write down all the health problems in that, in your case paper. Okay, they will cross check their notes with the case paper, whether everything has been written or not. So when you see this, you know exactly what is the constitution of the person. So you're already getting insights into the health of the person even before asking questions. Just looking at the way the person has written down chief complaints, associated complaints, it gives you a lot of insights. With the constitution person, you may not be even required to tell them write down since when you have been having these problems. The person will write down joint pain since 2 weeks. So this history of patient, or when you start taking history of patient, you have a certain time with you in which you have to understand the constitution, you have to understand the health problem, you have to understand the causative factors, you have to understand the pathology of the disease, and you also have to suggest them the treatments. You also have to explain them how to take the treatment and what will happen with that treatment. And usually, what is the time the person is going to spend with you? Maybe an hour, maybe an hour and a half. And in this, you have to do all this. And for that, the things that you did in diploma now, which was understanding of constitution, etc., they need to be done fast. You cannot be sitting doing constitution separately for 20 minutes. You cannot be doing constitution for, half an hour. So you will have to get into a habit of now trying to understand constitution by observing the person from top to bottom, trying to understand what is the constitution anatomically without asking questions. You don't need to, you should be, trained enough now not to ask questions about at least the anatomy of the person in terms of constitution. The questions that you would ask for physiology, that should give you insights into the constitution also simultaneously. Maybe a couple of questions asked for psychological habits or emotional things, etc., will give you insights into their mental constitution or their psychological aspects of constitution. But you can't spend more than 3 to 4, 5 minutes maximum for understanding constitution in this case, because here you are going to spend more time in understanding the disease. And that is something now that you need to start training yourself. And how do you train yourself doing that? Is observing the people. Start observing the people. Try and observe the people. Observe small things as to how they talk, how they, how they are dressed up, what they are saying things. That starts giving you a lot of insights into constitution and start making mental notes about it. I'm not saying you'll be 100% correct from day one, but you will get better as you keep on doing this over and over and over and over. So, chief complaints, associated complaints, history of present illnesses, history of past illnesses. You will ask all these questions and write them down in details. Then you will ask the person to write down family health history, which is, did they have any health problems? How was the health of the mother? How was the health of the father? How is the health of their siblings? Do they have any health problems, etc.? Ask them to write down. Why? Because that will give you insight into any particular weaknesses that have been passed on from the mother and father to them. Is there any weaknesses being passed on to their siblings, which will also give you an idea of, possibility of some weakness there in their body as well. So ask family history, and family history plays a big role, particularly if there is a family trait of having lifestyle disorders like obesity, heart problems, cholesterol, diabetes, etc. You will see a lot of family traits that, people going through the same pattern. And why is this pattern? This pattern is not something which is basically uh, passed on. The health problem is not passed on, you know, from the father or the mother to the child. The pattern of lifestyle is passed on. Certain lifestyles are passed on. Certain dietary habits are passed on, which is then, problematic for that person. See, end of the day, we have been living most of our lives with our parents. We are, we have been used to, or we are used to eating certain types of food when we were kids, when we were young, because we were living with our parents. That becomes an integral part of our lifestyle. Now, if that lifestyle and that food is harmful to the body, is not beneficial for the body, and you are not aware of it and you continue doing it because that's what is normal for you, then the chances of the lifestyle disorders which existed in the family happening with you or happening to you also are there. So basically, what is happening? The pattern of lifestyle, the pattern of diets which are passed on in the family as a lifestyle thing is what is damaging, is what is dangerous. And that is something that you understand from this family history. Apart from understanding of certain weaknesses, certain kavaigunyas which are being passed on from mother, father to you, etc. Is that clear? Any questions till now? Okay. Then the next is personal lifestyle of the patient. Okay. Personal lifestyle of the patient, which is the first and foremost is the diet. What is the food the person is having? So what do? You ask them to write down their complete food habits during the day, right from getting up in the morning. So ask them the question, at what time do they get up? What do they have for breakfast usually? What do they have for lunch usually? What do they have for dinner usually? What do they have for mid-morning snack? What do they have for afternoon snack? Ask them to write down those details. Or the reason we ask them to write down the details is because you have limited time. So if this information comes to you, then you can only ask more questions and get more clarification rather than asking these questions and wasting time on it, which is important for you. So ask them to write down all these details. These details will give you a lot of insights. Insights would be what? Insight can be as simple as what is the main meal of this person? Whether lunch is the main meal, dinner is the main meal. What will that tell you? That will tell you that, okay, certain problems if the person is having, can they be corrected by just changing the main meal? Say, for example, if the person's main meal is dinner, because the person works in the morning, comes back home, and then has a nice heavy meal with the family, because that's the tradition in the family to have a dinner together. Now, if that is the case, then you need to look at whether that dinner is heavier than it should be, whether the dinner is going on for too long, whether they are eating too late, there is not enough time between the dinner and the sleeping time. All these things will then give you insights into whether dinner is the problem in the entire health issue. If that's the case, only telling them that you need to look at reducing the quantity or reducing the quality of the food that is there, not having such a heavy meal in terms of quality, would be a simple suggestion that to do. A lot of times people would basically skip meals because of work. Understanding of that is also important, because if the person is pitta constitution and is skipping meals, probably you know can sustain for some time, but then afterwards that can start causing health problems to that person. What is the person eating? Is the person eating a lot of sweets? Is the person eating a lot of bakery products? Is the person eating a lot of carbohydrates? If the person's eating, what is the dietary habit of that person? That will give you insights into, is there any causative factor for the disease to happen, whatever disease the person is telling. I have seen people have strange ideas about eating. Okay. I did mention to you, I think I've spoken to you about this one person which I will never ever forget in my life, is this driver who came to see me, a cab driver who came to see me in Sydney. And this cab driver was extremely obese, looked absolutely unhealthy. And when I say absolutely unhealthy, meaning you could see, smell the ill health in him. You understand what I mean? He smelled bad, he looked bad from a healthy perspective. Now I'm not judging him from the looks, okay? I don't even remember his face now, but he looked unhealthy, he smelled unhealthy, he was absolutely unhealthy. And when I sat down with him and I asked him about his diet, he said, "Oh, I drive cab, so all I do is I pick up a bucket of chicken wings and I pick up a tub of ice cream, and that's all I eat whilst driving." So he was eating a bucket of chicken wings and he was eating basically, something like Red Rooster or KFC and eating a tub of ice cream with that. That was his meal, both the meals. So, one, he had no idea about what he was eating. He had no idea about how much he was eating. He had no idea about appetite, hunger, etc., because it was just there in his cab, sitting there. So, and when I say that he was an absolute picture of ill health, you could see that it was armor everywhere in his body. There was armor in the body everywhere. So when you see this kind of a dietary habit, you don't have to do anything more. You just have to make aware this person aware of the dietary habits. But you also have to understand that you can only suggest, you can only guide, you can only help. You cannot hold somebody's hand, or you cannot, tie them up and make them eat certain type of. You can only suggest. And when I was talking to him, I knew that I am talking to a wall. Nothing's entering in, you know. He was absolutely not receptive of anything that I was telling him. Now, this you will see a lot of times happening with patients who come to you. Patients are not, they do understand they do have a health problem. I'm not saying that they are not aware of the health issue. For a cab driver to come for an Ayurvedic consultation who is eating that kind of a diet itself is a big step, I would say. He could have gone to any Western doctor to take consultation. But coming for an Ayurvedic consultation, for sitting for an hour for a cab driver who had zero understanding of health was itself a big step. But there, when you talk to such people, you realize that there is only so much you can do for them. There is only so much you can suggest them. The rest is up to them whether they want to take it upon themselves to correct their health or not. Because why? Because the mind is not functioning properly in a lot of people. And if the mind is not functioning properly, then the chances are that the people will not listen to you. I have seen so many times, men who come for consultation, their wives or their partners have pulled them in, brought them in, made them sit in the consultation, and then they are sitting there trying to judge you as a consultant, trying to throw questions at you, trying to ask you, oh, I have this problem. Have you ever read about it? Do you know about this? That's the kind of questions they would ask. Why? Because they have zero faith in what you're doing. They have zero understanding of what you're doing. They are just sitting there because their girlfriend or their partner or their wife just pulled them in and brought them and made them sit in front of you. And mind you, these consultations can be pretty intimidating. And I'm saying this after doing consultations for 20 years. I remember these people who give you hard time when they sit in for consultations. I remember them. And that is also a learning curve because they will ask you questions, they will try and judge you, they will try and test you. And you should be ready, you should be aware, you should be, knowing what they're asking you. If you start going on Ayurvedic tangent and trying to tell them Ayurvedic concept, they're not there to listen to you. So you will have to adapt to them, you will have to talk to them in the language they understand. Try and build that rapport first where they feel that you're understanding what they are trying to ask questions to you, and you have answers for them in a language which they understand. And then once you have established that rapport, that's when you actually start sowing the seeds of the Ayurvedic information slowly into them. Because any which ways, Ayurveda is a very foreign science to a lot of people. So how do you approach a person whilst doing consultation is also very, very critical. You cannot be going bang, 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 take it or leave it. No. Because you are there to help them. So this is also a way of helping. Their mind is not functioning properly. That is why they are, trying to test you. That is why they are throwing difficult questions at you. That is why they are trying to test your knowledge. So you need to adapt. You need to understand why they are doing this. You can't get angry. You cannot shout and scream at them. You cannot insult them. So you'll have to adapt and you'll have to understand this, and you'll have to start talking in the language which these people understand. And I remember these cases. I remember these people, I remember when, they have come in. And the success is there when you see them the second time. When you see the second time, that means you're won over them, because the second time they have not come because their girlfriend pulled them in, or their partner brought them in. They came in because they saw the changes. They saw something worked. So the reason I'm talking about this, or the reason I'm saying this, is because I hope you have listened to the lecture that was posted. I hope so. Yeah, the retreat lecture. Now, what did you think about it? I'm not saying good or bad. Okay, don't say, oh, it was great, etc. What was the one or two things that you learned from that lecture? Is what I wanted to ask. Yeah.
I learned about the cholesterol,
Okay.
and I found it very interesting. Yeah, I learned very much in this topic on what they call the bad and the good cholesterol, which it's not bad and it's protection. And I found it very, very, very nice. And now I understand a bit better, and I can approach it more wisely, I guess, with clients.
Okay. Anybody else? Yes, Nicole. You need to unmute yourself.
Sorry. Yeah. Okay. Yeah, I was just having a look at my notes, but yes, the cholesterol was a big one that stood out for me. And yeah, how you explained how the LDL is just doing its job of protecting the walls of, say, the blood vessels, etc. And it's not that it's actually damaging. I mean, it is damaging what happens, but it's just doing its job. That was big for me. And then yeah, probably that too. Yeah.
So who did not, thank you, Nicole, and thank you, Doreen. Who did not listen to that lecture? Who did not listen to this? Who hasn't still listened to that lecture? Everyone has? Okay, I assume everyone has. So see the purpose for that was, and usually it starts with something. There is always a trigger that then makes you talk about certain things. Okay. So the trigger was that these people came in, and the retreat people are interesting because a lot of them are first timers to Ayurveda, who have read about it, who have probably just had a read at a book, or probably have read about it because they are practicing yoga, and then they know that Ayurveda has something to do with yoga, or it's similar science like yoga, etc. So these people are usually very, you would say, newbies to the concept of Ayurveda. That is number one. Now, the second one is that a lot of times these people are following the so-called trendy things that are prevalent in the system, because most of them, the reason they come for retreat itself is a big thing, because that's something they feel, oh, I should go and do a detox retreat because I think I have toxins. Yeah. Why you have toxins? Oh, because I have maybe pain, or I have this, that, whatever. So they have their ideas about toxicity, and then they have their ideas about detox, and they have read about detox. They have seen various retreats doing detoxes, etc. So they mostly come because of that. And this time it was like uh, the night before the lecture started, we were sitting at the dinner table, and I think we were talking about ghee. And when we started about talking about ghee, there were people who started talking about ghee. I don't eat ghee. It's cholesterol, it's fats, and it's problematic. So Shanti was sitting there, and she said, um, Manish, you need to talk about ghee, and you need to make these people have ghee from tomorrow. So that was the trigger why this lecture happened, basically, because when we talk about ghee or when we talk about fats, there is this misconcept about fats in terms of how fats are bad. And it is like, it is like basically you are on the road, yeah, somebody hits somebody by the car, and just because you were next to that car, you are being held responsible. That's how really the fats are being labeled and blamed. I mean, the real culprit is cholesterol, the real culprit is cholesterol, and then we are blaming fats because of they're trying to help the body. And I'm not even saying that the real culprit is cholesterol, because that's also doing its job. The real culprit is basically the weaknesses that we create in the body. End of the day, what was the lecture about? The lecture was that the problems is not with the cholesterol, the problem is with the blood vessel. When the blood vessel walls are damaged, that's when the cholesterol will start acting like a band-aid and repairing it. And as the damage becomes more and more, the more band-aids that you apply, the more thickening of the wall will happen. So obviously, the cholesterol, which is doing the job that it's supposed to do of repairing, we are blaming that cholesterol. We are not even worried about the health of our blood vessel walls, which is the root cause for this. And we are not even worried about why this damage to the blood vessel walls is happening. So the reason that I spoke about that was mainly because of this, that we are blaming something which is not really uh, problematic, so to say. The problem lies in something else. We are not even worried about that problem. That was number one. Secondly, I also wanted to talk about the importance of digestive system and the importance of liver as such in this whole concept of detox. And liver, we have been talking about this all throughout our diploma, advanced diploma as well, that liver is a very important organ. Liver plays a very vital role in keeping you healthy, or making you unhealthy. In a cancer patient, okay, what is the worst situation in a cancer patient? what is the doctor always asking? How is the appetite? How is the appetite? Is the question the doctor will always ask a cancer patient. You know why? Because the moment the liver is affected and the appetite is affected, it is only a matter of couple of months after. I have seen patients, who have lost 20, 30 kg over the 4 or 5 months after their liver was affected and when they affect and their appetite was reduced. And that is the end. The moment the liver is affected, the moment the secondary spread in the liver, the moment the appetite reduces, that is the end. Why? Because the moment the liver is affected, your detox system goes out of control. Your blood starts becoming impure. The impure blood starts spreading in the body. So it is not just about your appetite, your hunger, and your eating food and nourishing the body. Your entire body starts getting toxicity. And that is why liver health is extremely crucial if you have to maintain a healthy life or if you want to be healthy. Today, a lot of these talks are going out about inflammation being the cause for various health problems, right? Inflammation being the cause for various health problems. Your gut health is responsible for health problems. Now, what is inflammation basically? Inflammation is 100% under the control of liver. Your liver is the organ which is making your blood. Your liver is the organ which is responsible for the quality of pitta in the body. Your liver is the organ which is responsible for the quality of blood in the body. And inflammatory processes will be controlled by liver. If the liver is functioning properly, the body is getting detoxed. If the bile secretion is happening properly, if the pitta formation is happening properly, inflammatory processes will not happen in the body. So the reason I am mentioning this is because we spoke about something which was talking in the language people understand. If you start talking in the language people understand, if you try and explain the Ayurvedic concepts, it may not even be an Ayurvedic concept. You don't need to really explain an Ayurvedic concept. You just have to explain a concept because if the concept is clear, then the Ayurvedic ideas become very clear. Like the moment you are clear about what LDL, HDL does, and the moment you are clear about LDL doesn't really have a role to play in causing your heart problems, it is actually the health of your blood vessels, then you're not going to blame fat consumption as the root cause for that. So then when you say consume ghee is not going to be a problem. So making people understand the concept which have been, I would say, I'm using this word twisted a lot of times by the Western science also for the benefit of certain industries. For the benefit of certain industries, certain concepts have been twisted. And those twisted concepts are then causing problems and increasing problems in the body. So if you read and if you explain and if you tell people that this is not what is the fact is something else, people understand and people incorporate those changes into their lives. So cholesterol was one thing. Cholesterol also, like I explained, it is responsible for your sex hormones, your testosterone. It's responsible for your brain nourishment. So if LDL is doing all these functions, why blame that poor, lipid, which is actually maintaining the health of your brain? giving you testosterone and giving you the sex hormones which are responsible for the next progeny also. So if all that is happening because of lipids, it's strange to blame that entity as causing problems and being so scared about it. So read properly, understand concepts properly, talk in the language people understand. That is extremely important. And coming back to this, uh, we were talking about the diet, etc. So take down the dietary habits people have. They will give you a lot of insights into what people do. Sometimes people will be drinking a lot of coffee. Now, what is coffee doing? You need to be aware. Now, let's not blanketly blame anything. Okay, first of all, when we look at Ayurveda, I never ever blanketly blame anything and say that, oh, this is something that has to be completely stopped. Okay, there is always a principle of moderation. Okay, there is a principle of moderation, and if you keep on applying that principle of moderation, people will come back to you again and again. There are two things which I always do. Okay. When I examine a person, apart from all the examinations I do, I also examine the strength of the mind of the person in the entire analysis. What is that strength of the mind? The strength of the mind I examine for one simple reason. Should I give the entire basket of treatment just now to this person? Should I take this person through phase 1, phase 2, phase 3 of treatments? Are you understanding what I'm trying to say? If there are 25 things that I need to do with this person, should I give all these 25 things in one go? Or should I ask the person to do 7 things or 8 things now? Come back after 15 days. We start with the remaining 8 more. Come back after 15 days. We do another 8 more. This is what is also critical when we are analyzing the person. And why is that critical? Because some people, some patients do not have the mental ability or the mental strength to do a lot of things in one go. And you believe me, if you analyze the person properly and you tell them point blank that I am not going to give you everything that I think you need to do. We will go step by step with you. We will only do these 5 things with you right now. We will see how they benefit you over the next 10 days. You come back to me, we will start with 10 more. The person will immediately say, oh, that's good. Because I thought you will give me 20 things to do and I am never able to stick to 20 things. That is what the person will immediately reply if you have understood the analysis of the person properly, which is going back to their constitutional understanding. If the person is a Pitta or a Kapha constitution person, the chances of these people sticking to what you are telling is more. If the person is Vata constitution with a further Vata aggravation, then the chances of this person sticking to 20 things is overwhelming for them. And one thing which you certainly don't want to do is overwhelm the person with 20 things and 20 medicines and 20 treatments to be done in a day. The person will not even do one thing, will stop doing everything after 2 days. Will never ever come back to you. But if you make that entire journey into different steps and different phases, the chances of that person sticking to what you have suggested is higher. and the chances of that person getting results is higher. And the moment they start getting results, they also start getting better mentally. And that is also an approach. The beauty is not about, oh, how great a consultant I am, that I give 20 things which I know are best for that person. The beauty of being a good consultant is also understanding what will be the right approach of doing the treatment on this person. And I'm not saying that make a note of all the 20 things, but then decide what 5 or 8 things that you want to start with it in phase 1. Go step by step. You will see better results with these people a lot of times. I mean, I constantly do that. If I see that this person is not going to follow whatever I'm telling them, I only tell them 5 or 6 things. If I feel I need to give them 8 supplements, I will probably only start with 3 most important. And I see them coming back more number of times than not coming back. So this understanding is also very, very critical. So coming back to this is why I started talking about this is because I never ever consider extreme measures of stopping something completely unless it is at most necessary. Okay, Ayurveda does not say that there is anything that can only be labeled as beneficial and there is something which can only be labeled as non-beneficial or to be completely eliminated from your lifestyle or from your diet. Moderation is what Ayurveda always say. Everything in moderation is okay. Now, what is that moderation? That moderation will depend on various factors. That moderation will depend on the constitution. Moderation will depend on the disease. Moderation will depend on the Agni. Moderation will depend on, the age, etc. If I take an example of coffee and the person is having 8 cups of coffee a day, yeah, I will tell them you need to reduce the coffee. But I will never say from tomorrow, no coffee. That's never going to happen. The person will go back laughing, smiling, saying that, I met a doctor called, I met a consultant called Doreen and she asked me to get off the coffee. She is, she doesn't understand anything. We don't want that. So never ever do that. If the person is having 2 coffees or 3 coffees and you feel that, yeah, okay, you need to reduce, you can always say, maybe, having 1 coffee a day in the morning is fine because you get up in the morning, you need something to push yourself. Okay, go ahead. Try and see if you can avoid the remaining 2 coffees because it's not necessary for you. So moderation plays a very important role in the entire suggestions that you give. And if you apply the principle of moderation in everything, you will get better benefits and better results. A lot of times people are eating sweets, people are eating chocolates, people are eating, drinking alcohol, people are smoking, people are doing drugs, people are eating bakery products. You see that in their diet regime. But what Ayurveda says, anything that is not beneficial for the body, even if you have to get rid of that, go step by step. So what does this step by step mean? Step by step means cut it out gradually, which brings us back to the principle of moderation. Reduce it, never stop it. So the diet history is extremely important. You need to take the diet history. The diet history will give you a lot of insights into what you need to stop, what you need to incorporate in terms of foods, etc., etc. Then the next thing is Agni. Understand the Agni. We will come to this. Let's have a quick break and come back. Okay. 10 minutes, 15 minutes. We'll be back in 15.